Is it all right if I come in?
Yes.
Hello, my name is Maya. I will be your student nurse for today. Could you please state your name and date of birth for me?
Meredith Gray.
Your date of birth,
Birth.
please. Okay, thank you so much. Could you please tell me where you are and why you're here?
I'm at the hospital, going in, head to tail section,
Okay, and do you know today's date?
December 3rd, 2025.
Okay, thank you so much. Patient is alert and oriented to person, time, place, and situation. Patient's clothes are clean. Nails are clean. She is dressed appropriately for the weather. No odor. Her hair is clean. Posture is erect. Speech was clear. Do you have any allergies?
No.
Okay, are you having any pain today?
No.
All right, so next I'm going to be checking your vital signs, and I will start with your BP. I'm going to find your brachial artery. Patient's BP was 130/90. So now I'm going to take your pulse ox now. Okay, patient has a pulse ox of 98 on room air and respiration was 16. Next I'm going to take your pulse. Okay, patient's pulse was 80 beats per minute. Next, I'm going to take her temperature. Okay, patient's temperature was 98.5. And next, I will be doing the patient's height and weight. All right, patient is 5'2" and 170 pounds. Next, I'm going to be inspecting the head, face, and neck. So I'm going to put my gloves on. So by just inspecting, her head is symmetrical. I don't see any bumps or lesions on the head or the face. Now I will palpate for any bumps or lumps. Next, I will check the face for any bumps, lumps. Facial features are symmetric on the face. Okay, now I'm going to check the frontal and maxillary sinuses for tenderness. Next, I'm going to be checking the sensation in her face. Could you close your eyes for me? And can you tell me if this feels like a dull or a light feeling?
So, no.
Okay, patient's cranial nerve number 5 is intact. Next, I'm going to be inspecting the neck. I do not see any deviations of the neck or the trachea. The trachea is midline of the body. Could you swallow for me? Okay, no thyroid enlargements. And I will check one carotid at a time. Okay, no abnormalities in the pulsing of the carotids. Next, I'm going to check for jugular distension. No jugular distension. And now I'm going to feel for the tonsillar lymph nodes. Okay, I do not feel any lymph nodes, which is a good sign. So now we're going to check your range of motion of your neck and your shoulders. So first we'll do your neck. Could you just turn this way? Turn the other way. Up, down. Okay, range of motion in the neck is suffice. Next, let's check your shoulders. Raise up. Okay. Cranial nerve number 11 is intact with resistance in the shoulders. Next, I'll be moving on to her eyes. Eyes are symmetrical in the correct position on the face. Sclera is white, conjunctiva is pink, iris are equal in color on both sides, and pupils are equal in size, round, check if they're reactive to light. Okay, pupils are reactive to light. And look at the pen for me. Okay, and pupils accommodate. So now I'm going to do the 6 cardinal signs. So please follow this pen light for me. Okay, patient was able to do all motions with her eyes, and that was assessing cranial nerves 3, 4, and 6. Now I'm going to be inspecting the ears. I'm going to inspect for size, position, and the size is appropriate for her head shape. It's in the correct position on her head, and there's no tenderness of the pinna when palpating, no drainage in the ears. Next, I'm going to be doing a whisper test. So just repeat after me what I whisper in both ears.
I wear white socks. Pizza.
Okay, patient was able to hear what I whispered in both ears. Next, I'll be checking patient's nose. Okay, so patient's nose is midline of the body. Nares are equal in size, and septum is midline of the nares. I do not see any drainage in the nose. Mucosa is pink and moist. Next, I'm going to be checking her sense of smell. So close your eyes for me and please tell me what this is.
Cinnamon.
Okay, you're correct. Patient's cranial nerve number 1 is intact. So now I'm going to be inspecting the mouth. Patient's lips are moist and equal in size and in a correct position on the face. Open, please. Okay, patient's teeth are white. Gums are tight around the teeth. Please. Okay, tongue is in appropriate space. Patient's uvula rises when she says ah, and no lesions in the mouth. Next, I will be checking my client's respiratory system. So first I'm going to ask, do you have any history of lung disease?
No.
Tobacco use?
No.
Any conditions going on right now? Pregnancy?
No.
Any prior surgeries?
No.
Okay, so my patient doesn't have any history of respiratory distress. And now I will be inspecting her chest cavity, and I do not see my patient is barrel-chested or using her accessory muscles to breathe. Next, I'm going to make sure that my client doesn't have any abnormal curvatures in the spine. So I'm checking for kyphosis, scoliosis, and there's no signs of that in my patient. All right, now I'm going to be palpating and percussing the posterior area of the lungs. Okay, so now I'll be auscultating the lungs and the posterior cavity. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay, I do not hear any wheezing or crackling in the lungs. Next, I will be inspecting lung expansion just to make sure that the lungs are bilateral and equal in inspiration and expiration. Inhale, exhale, inhale, exhale, inhale, exhale. Okay, so next I'll be moving on to the cardiovascular system. Do you have any history of cardiac disease?
No.
Any chest pain currently?
No.
Fatigue?
No.
Do you take any cardiac medications?
No.
Do you exercise regularly?
No. I'm in nursing school.
Okay.
I have the time.
Well, patient doesn't have any signs of cardiac distress, so now we'll move on with the assessment. Okay, now I'll be listening for the 5 heart sounds and the apical pulse. Okay, so pulses were heard in all 5 landmarks, and I was able to receive an apical pulse. So next we'll be inspecting the abdomen. So if you could lay back for me, Okay, so I'm going to be inspecting the abdomen from 2 angles. Okay. So far, I don't see any signs of distension in the abdomen. And now we'll be inspecting. The belly button is, the umbilicus is in the correct position, and color is the same as the rest of the body. Next, I'm going to auscultate all 4 quadrants of the abdomen to make sure that I hear bowel sounds in all quadrants. Okay, bowel sounds were active in all 4 quadrants. Now I'm going to percuss and palpate the abdomen. All right, now I'm going to palpate. Any pain?
No.
And are your bowel patterns pretty regular?
Yes.
Okay. So patient's bowel patterns are also regular. Any constipation, diarrhea?
No.
Nausea, vomiting?
No.
Okay, thank you. You can sit up for me. So next I'm going to be assessing her skin, all right? So I'm just going to look at what I can see so far, and her skin is equal in all areas of the body, the same complexion. I'm going to check her capillary refills of her nails. Okay, capillary refills under 2 seconds. No clubbing of the nails either. I do not see any lesions, drainage, no irregular moles. And now I'm going to check skin turgor. Okay, skin turgor is under 2 seconds. Now I'm going to palpate the skin for temperature. Okay, no abnormalities in her temperature. Okay, now I'm going to check edema in the lower extremities. No signs of edema. I'm going to palpate the joints and muscles down here. Any pain?
No.
Check the joints and muscles up here. So now, finally but not least, we're going to be checking her neuro. Okay, so we're going to first start off with checking her range of motion and her motor skills. So I'm going to start with the upper extremities. So if you can, please touch your nose and then touch my finger. Touch your nose, touch my finger, touch your nose, and touch my finger. Patient is able to, touch her nose and then touch my finger. Okay, so now I'm going to do the same thing but on the lower extremities and have her put her heel to her shin, and again, shin, shin. Okay, now I'm going to be doing my patient's reflexes in the upper extremities, checking her brachial reflex. Okay, thank you. Okay, patient's reflexes in the upper extremity were intact. Next, I'm going to check her popliteal reflexes in the lower extremity. Okay, patient's reflexes are also intact in the lower extremities. Next, I'm going to check the sensation in her upper and lower extremities. Okay, close your eyes, please. And tell me if you feel a soft or dull sensation. Okay?
Soft.
Okay.
Dull.
Right.
Soft. Dull.
All right, thank you so much. Patient was able to feel soft and dull sensations in both the upper and lower extremities. So now I'm going to have my patient stand up, and we're going to be checking her balance. So you can stand here with your eyes closed, and I will be doing the Romberg test. Okay, thank you. Patient was balanced. There was no moving side to side. Next, we're going to be assessing your gait. So you can just walk this way from heel to toe. And walk back. Okay, patient's balance was intact. So I'm going to give my patient her 7 outs. I will let her know that I will be leaving for the rest of the day. If she has any more questions, she can feel free to ask me now. I will again perform hand hygiene. I will check the surrounding areas to make sure the patient cannot get hurt. I'll have her bed to the lowest setting, and I will have her call bell next to her and all her needed essentials.